105.1 The Buzz with Daria, Mitch, and Ted. Let's welcome to the show cosmetic surgeon, Dr. James Chan.
Hi.
Hello, Dr. Chan.
Hi. I have some paperwork for you. You know, you doctors love paperwork.
That's right. We love it.
A new survey found the top 10 physical signs of aging that bother people the most.
Uh-oh.
Here they are. Number 1, excess weight. Number 2, skin texture or discoloration issues. Number 3, wrinkles and lines around or in between your eyes. Number 4, these are in order, by the way.
Okay.
Sagging or loose skin on your face. Number 5, a double chin.
Don't look at me.
I didn't.
I have 1 through 5 so far.
6, laugh lines and wrinkles on your cheeks. 7, wrinkled skin on your neck and chest. 8, forehead wrinkles. 9, hair loss. And 10, acne scars. Now, this is what is frustrating, I think, from a plastic surgeon point of view. That this is, and this was a huge survey, these are the things that people are so bothered about their appearances at ages. And do you know what I'm going to say?
They can be corrected.
They can all be corrected.
Yeah.
And almost all of these, the vast majority, can be corrected with little to no surgery at all.
Yeah.
Yep.
How about skin texture and discoloration issues? That's 75% of all people asked said that was the worst.
Yeah. Lasers. Lasers are great for that.
It's as simple like that.
What? She's been doing crazy voices all day.
That's not crazy.
Okay, all right.
It's as simple as that.
Oh, it's as simple as that.
But I was saying it
is that
whimsically.
Colonel Sanders?
Yes.
Wow.
She's been channeling Colonel Sanders.
Kentucky Fried Chicken. He was
Yeah.
like, Dr. Chan knew who it was.
Oh, yeah.
Oh, yeah.
He was like, what? How'd you do that? How do the lasers help skin discoloration? And that would mostly be like age spots and sun damage and stuff like that, right?
Yes. There's several different lasers that you can use for that. IPL, we've talked about that on the show many times, that basically gets rid of some of the brown spots, red spots. And then the resurfacing lasers, like the CO2 laser, that really helps not only eliminate the browns and the reds, but the wrinkles.
What about acne scars?
Acne scars, the CO2 laser is probably the best. It's a very difficult thing to treat, and you can make some improvement with it, but generally they don't go away.
It's frustrating, isn't it?
I've had some people tell me you can get rid of acne scars with microdermabrasion, and that's just crap, right?
It is.
I mean, you
You're
have to
not
go
getting
down
it.
to like the bone
Yeah,
with that.
right.
Microdermabrasion
Yeah.
is like it's like an electric toothbrush,
Right.
except instead of the brush head, you have this, is it diamond?
They have different ones.
They have
yeah.
really hard sandpapery thing, and it goes all over your face it's
I've had it done
like
once.
like a cat scratching with
Yeah.
its tongue. I'm told. I would never let that happen in a million years, but the microderm I would. So tell us about. We were talking about lines on the face, and one of the big ones is wrinkles and lines around your eyes. You were doing this thing where that you were testing a brand new thing that, specifically for the 11s, those frown lines. Like if you've got your eyebrows, and now picture you're frowning, and in between your eyebrows are like an 11.
They call them the angry 11s.
The angry lines. You've got them.
I sure
Two
do.
vertical wrinkles.
Everybody in my family has them.
Yes.
Tell us what's going on with that at your clinic.
Yeah, so the standard treatment for that currently is Botox, and Botox is, pretty much a blockbuster in plastic surgery. But despite that, a lot of people still don't trust Botox because it's a toxin. They don't like it because you have to keep coming back to get it, every 3 months. So now there are some alternatives to Botox, and one of them is one called Nubel, and that's the one that we are doing a clinical trial on in our office. And what that does is basically you find the specific nerve that innervates that muscle that creates that wrinkle, and you zap it, and you weaken it. So therefore you basically relax that wrinkle. And it doesn't require any toxin. So far, the initial studies show that it's lasting 3 to 4 times as long as Botox.
Wow.
That's impressive.
Yeah.
What does it zap it with?
So it uses radio frequency.
See, that's not a dumb question.
No,
Like I
it's
don't know
not
if it's
at all.
zapping it with
No.
like candy, electricity,
Venom.
Love.
cold.
Some sweet, sweet love.
Yeah.
Yeah. People have tried all of those things, almost all of them. But yeah, really cold. This is more heat. It's it stops the conduction of the nerve. It's not permanent, but it's long lasting enough that it gives you about a year to year and a half.
And what's the treatment called? Is it?
So right now, I don't even think there's a formal name for it.
Okay.
It's just Nubel
Okay.
is the device, and it's a special probe It allows us to identify the nerve. So you have to put it just under the skin, identify the nerve, and you zap it. And you do it right here near the outer corner of your eye.
Okay.
So it sounds like it does potentially hurt, but just for a second.
Yeah, we put a little bit of numbing, a little bit of lidocaine in the skin because you do have to go under the skin. It's like getting a little needle stick.
I like pain in the face.
And you like needles? And
I do. I
shots?
like needles, and I don't like as long as it's some sort of procedure that ostensibly will make me better looking.
Right.
I don't care how much it hurts. In fact, if it hurts a little bit, I
working
sort
better.
of like it more. Yeah. So are you still looking for? Because I know you were looking for volunteers, and they actually it's sort of like temporary hirees because not only do you get this treatment for free, this experimental treatment, that's has it been approved elsewhere?
So it's the device itself is FDA cleared.
Okay.
So what we're trying to do is submit it to the FDA for a specific indication, which is for this particular wrinkle for cosmetic use.
And he's pointing to the Angry 11s.
So not only do you get that treatment done for free, and who knows what it's going to cost if it turns out that it is going to spread nationwide, but you also get paid
you're
for doing it.
compensated. Yeah. Right.
And so you still need a few more volunteers. Now, describe a perfect volunteer? What does their face look like?
So somebody who does not have a very deep wrinkle at rest, but when they frown, they have a really strong 11, or sometimes there's 1 or maybe 3 lines. Depends on the person.
You would be a good candidate.
Mitch
Dr.
looks
Chan,
like
'cause you have
looks like he's got more of a 44.
You got some
or
horizontals in
77.
there.
Mitch has an L7. So is there a website to go to, a number to call, or what?
Yeah, so there's a study coordinator. Her name is Catherine, and her number is 206-304-0088. 206-304-0088. And contact her, and she'll set you up for a screening.
Is that number on your website also, drjameschan.com?
Yes.
Okay.
Okay. That's
DrJamesChan.com
and her name's
if
Kathy?
you're driving.
Catherine.
Catherine.
And again, to state it again, get some work done on your face
And get paid for it.
Get paid.
This isn't where like you pay to have your frown lines go away. This is where you get your frown lines go away for free, and then you get money on top of it.
Yes.
If you qualify.
If you qualify.
Oh, you're going to qualify. Thanks, Dr. Chan. Visit his webpage as well. Find out more information about Revion's Portland, which is his dermatological clinic, where you can get all sorts of things like he described here, the Botox, the lasers, et cetera, non-surgical. And, of course, surgical plastic surgery, facial options as well. DrJamesChan.com, the website.
Thanks, Doc.
Thank you.